this orthopedic assessment of the subtalar articulation with patient Grant Peabody, practitioner Nick Berry. So before we begin the examination, I'm going to inspect both of your articulations, and what I'm going to be looking for is for redness. I'll be looking for swelling, which are both cardinal signs of inflammation. And then on top of that, I'm just going to be looking for any open wounds or any kind of surgical scars that I may not have heard about in the patient history. And then the final thing I'm looking for, which I don't happen to see, are any deformities within the 3 cardinal planes of movement. And so now the inspection is out of the way. I'm going to be going into the palpation. And so to start for palpation, I'm going to be starting up at your knee. And so is it all right if I make contact with your body? All right, thank you very much. So I'm going to be running down your tibia. And when I'm doing this, please let me know if you have any point tenderness pain. So if I press down in any one specific area, please let me know. And I'll be ending that at your medial malleolus. And through that, you felt all of those points with your finger. All right, that's perfect. So you had a sensory afferent touch. And now I'll be going down the first third of your fibula. And then I'll be ending it at the distal third on the medial malleolus. All right, perfect. And now the second part of the palpation, I'm going to be down on your calcaneus. Okay, how is that?
Feeling good.
All right, perfect. So now, before we get back to the ankle, I'm going to start at your toes, and then I'm going to check your forefoot. Okay, so I'm going to start up here at your great toe, and then I'm just going to palpate these small bones or your phalanges. And any pain?
Nope.
Okay, and then I'm just going to run through all 5. Perfect. And now right down underneath your great toe, you have 2 small bones called sesamoid bones. And so I'm just going to check those. Okay. And all right. And now I'm going to go on to your metatarsals here. So let me know if you have any more pain, all right? Perfect. And now for the final part of the palpation, I'm going to come in here, and you have 4 small little bones right on the forepart of your foot, forepart of your foot, pardon me, and I'm just going to palpate those very quickly. All right, perfect. And now for the second part of the examination, we're going to get into the passive range of motion stage. So I'm going to have you stand up, and then I'm going to have you stand flat on. All right. So now I'm going to be touching this right here, and I'll be touching over here. All right, and relax for me. And I'm going to pull your ankle up and sit right there. So this is what's called talar neutral position, and so this is the correct architecture of your foot, all right? So now I'm going to come in really quick, so holding that position, and I'm just going to mark the small bone called your navicular, all right? So now relax your foot. All right, so I'm going to bring you back into that position, and then I just want you to hold that position, all right? And up. All right, perfect, and hold that for 1 second as I mark it on a card. All right, and relax your foot. All right, perfect. And if you can take a seat again on the examination table. Okay, so there's a slight distance right here. So that right there is what's known as your ankle drop, or the amount that your ankle pronates when you're stepping. All right, so now for the second part of our active range of motion test, I'm going to be testing the movements of the ankle, right? So relax your foot, all right, and I'm going to push your foot into dorsiflexion, all right? And I'd like to now have you do that on your own real quick. All right, perfect. And any pain associated with that? All right, so now I'm gonna do the exact same thing, except I'm gonna apply what's called overpressure, okay? So I'm gonna count to 5, 2, 3, 4, 5. Perfect. All right, so now we're gonna move on to plantar flexion. So I'm just gonna pull your foot down, all right? And now I'd like to have you do that. All right, perfect. And now I'm gonna apply overpressure. 2, 3, 4, 5. All right. And now we're gonna go into ankle eversion. So rolling your foot like that. All right. Perfect. And I'm gonna apply overpressure. 2, 3, 4, 5. And now we're gonna do inversion. So exactly foot like that. And now I'm gonna apply overpressure. 2, 3, 4, 5. All right, perfect. You have proper strength of all the muscles associated with the subtalar articulation. All right, now I'm gonna have you lie over on your stomach and then flex this knee up. Oh, sorry, actually before I get to that, I'm gonna pull out my goniometer and I'm gonna measure the amount of eversion within your ankle. Okay, so I'm just gonna put this right on the back side of your Achilles tendon and match that up. And there's about 1 degree of ankle eversion. And comparing that bilaterally, they're about the same. All right, so now getting back into the passive range of motion test, I'd like to have you get your knee at 90 degrees. And now I have pull your big toe up towards your knee, and then also pull your ankle up towards your knee. All right, perfect. And now I'm gonna pull you down and resist that motion. So 3, 2, 1. Perfect. All right, that was great. And then, sorry, you're gonna lie back on your other side and sit up, please. All right, and our second test, we're gonna test the tibialis anterior. So flex these toes, pull these toes up towards your head, and then turn your foot so your pinky, the bottom of your toe, great toe falls down, and then your pinky toe goes up. All right, and I'm gonna pull you down and resist that motion. So 3, 2, 1, and excellent. And all right, that was an orthopedic evaluation of the subtalar articulation.